Okay, so big topic right now. You've heard a lot of people talking about the Wolverine stack.
Oh, yeah.
What can you tell me about the Wolverine stack?
So let's be basic about that. BPC-157, and then the other part of that is thymosin alpha 4. Okay. What is BPC? We talked about growth hormone releasing healing peptide through the liver. The thymosins are meant to stimulate or to take some immune system problems in or out of the situation. So when you're looking at Wolverine, you're looking at BPC healing the joint, while you're also looking at the thymosins, which are going to take your immune system and downregulate some of the issues that cause or detract from healing. TB-500 is the other name for it. So if you see BPC with TB-500 and it's named Wolverine, which is a cool sounding name,
Yeah.
might as well make it sound cool. So yes, that is it. So TB-500.
I think it's from the movie about the Marvel movie with Wolverine because,
We could all look like him, right?
yeah,
Exactly.
he could heal himself instantly. That was
Yeah.
his superpower. So how do they actually work in concert together? Does one start the healing, open the healing process, and then the other come in like a 1-2 punch? How do the two actually work together?
The problem with healing an injury is when your body has an injury, it sends inflammatory mediators out into your system that initially are helpful, cause inflammation, you get all your typical symptoms. So the BPC 500 is concentrating on sending the right things for rebuilding and repairing that tissue. The TB 500 or thymosin is trying to keep the parts of your immune system that can keep the healing process or detract from the healing process out of that situation. So it's as simple as that. One is focuses on healing. The other one focuses on keeping the immune system out of the situation so that you can heal quicker. And just think, when you go take a Motrin or an anti-inflammatory, yeah, you feel better for a few minutes. This is a little bit more complex, obviously, and a little bit healthier, but it just keeps your inflammatory mediators and things out of the situation.
One of the superheroes is doing the work while the other one is keeping the crowd or other.
That's right. The guard.
Villains.
They think of a militaristically. You've got people doing the work, the fight in the middle, and then you got people protecting them around the outside of that. So yes, your BPC is fighting the battle, fixing the problem, and then your TB500 is making sure that nobody else comes in from outside that situation to detract from what you're doing.
Great analogy. I've heard people say that they were going to have surgery and they started the Wolverine stack and injectable, and it actually healed their tendons. Is that true?
Yes. Now, there's a bunch of ways to heal joints, tendons, muscles, cartilage that doesn't involve surgery. Now, you go to a surgeon, and their surgeons are wonderful people, but they are about surgery. If you don't want to have surgery, there's several different avenues you can go down. You can use the peptides. You can use PRP, platelet-rich plasma. So there's another side to that. So if you want to heal a joint, peptides, great. PRP, great. You can combine those two. That's the ultimate 1-2 punch right there. Wolverine, PRP. Wow. If you do those, and if you don't feel markedly better or fix your problem with those, you probably do need surgery. Yeah. So they're very powerful non-surgical healing modalities that use your own body.
And what's a typical time frame for the healing to occur?
You got to be patient, obviously. So for a peptide, you're going to feel better within a few weeks, but it's going to take anything that's damaged is going to take several months to get better. So with the peptides, you need to probably take 2 to 3 months or more and slowly get the recovery along with you. You have to do the physical work with it. 2 is things like PRP, just to kind of add that platelet-rich plasma which we do here also, is that takes a 3 to 6 month block. But once you've done that, usually with the first injection of PRP, people feel markedly better. But if you're patient and you do the series, you're going to recruit and recreate new tissue through the stem cell, anti-inflammatory mediators, all of it. So they do work in concert. There's a nice combination there.